Before a child is assessed for a speech disorder, a referral is made. A child can receive services as early as 3 years of age. Typically, when a child is referred at this age, it is the parent that has requested the referral. Once a child starts school, the teacher or the parent are the ones that typically refer them to the speech pathologist. The earlier that it is determined that a child has a speech disorder that is able to receive services, the better it will be for their academic success. If the teacher refers the student to the speech pathologist, then the speech pathologist typically does what is called like an informal assessment. This is quick and easy and allows the speech pathologist to come in and just have a conversation with the child to determine whether they do have a speech disorder that needs to be further assessed that could qualify for services. Formal evaluations are more thorough, and the SLP will go ahead and do this type of assessment if it is the parent that is requesting the referral. The Goldman-Bristow test is most commonly used, and it assesses consonant sounds in every position of the word. In order for a child to be able to receive speech therapy, there must be something that with their speech that impacts their education. This can be as simple as them not wanting to participate in class. Some students that have speech disorders will not talk out or participate in classroom discussions due to the fear of being made fun of for their speech disorder. When assessing a child, all other factors must be considered. Does this child have just a speech disorder, or is there some other disorder or diagnosis that is causing their speech delay? A lot of times in schools, students are brought up to the SLP to be assessed, but it turns out that they do not have a speech disorder that impacts their education. My friend used to be the SLP at our school, and me being a PE teacher, I would see every student in the school. So a lot of times I would pick up on kids that might need to be assessed before the teacher did. I would always bring up these students to her because of reasons that, like me being unable to understand them. More times than not, these children did end up needing to be assessed and were able to receive speech services. But occasionally, the student was not education impacted and they did not qualify for receiving services. I feel that if teachers had like a little sheet that showed them what to look for and sounds that are appropriate at those ages, it would be easier for them to know who to refer and who not to refer. And in those cases, it would help children that do need to have speech services and qualify for speech services to be caught at an earlier age and to be able to be successful academically.